I want you to do something right now. Go find your most recent blood pressure reading. It doesn't matter if you checked it this morning, last week, or at your last doctor's visit. Just find that number. There is one specific figure on that reading, not the top number and not the bottom number, that researchers at some of the world's leading neurology centers have quietly identified as one of the strongest early predictors of Alzheimer's disease. And most people, including most doctors in a routine checkup, never talk about it. If you are over 60 years old, what I'm about to share with you in the next few minutes could genuinely change how you think about your brain health for the rest of your life. Stay with me, because this matters more than almost anything else you will hear today. If you are between 60 and 80 years old, if you have ever been told your blood pressure is a little high, or even if it has been normal for years, more than 70 million Americans over the age of 60 live with some form of elevated cardiovascular risk, and nearly 6.7 million Americans are currently living with Alzheimer's disease. What the science is now revealing is that those two statistics are not as separate as we once believed. They are deeply biologically connected, and the connection runs right through your blood pressure. I'm going to walk you through real science in plain language, share what researchers have discovered, and give you tools that are practical, affordable, and proven. Picture this. A woman named Dorothy, 68 years old, retired school teacher from Ohio. She has been checking her blood pressure at home every morning for the past 2 years, just like her cardiologist told her to. Her readings have been pretty consistent, around 138/82. Her doctor says it's on the higher end of normal. They're watching it, but nothing urgent. Dorothy feels fine. A little tired sometimes. She notices she has to read things twice before they sink in, but she figures that is just aging. What Dorothy does not know is that the difference between her top number, 138, and her bottom number, 82, is 56. That gap has a name. It is called pulse pressure, and that number, 56, is quietly one of the most important brain health indicators in her entire chart. Pulse pressure. Write that down if you can. It is simply the difference between your systolic pressure, the top number, and your diastolic pressure, the bottom number. So if your reading is 130/78, your pulse pressure is 52. If it is 145/80, your pulse pressure is 65. Because a pulse pressure that stays consistently above 60 is now recognized by researchers as a significant risk factor for accelerated cognitive decline, brain atrophy, and Alzheimer's disease. When you were young, your arteries were flexible. Think of them like a new garden hose, soft, springy, able to expand and contract with every heartbeat. As we age, the walls of our arteries begin to stiffen. The medical term is arterial stiffness. Those flexible hose-like walls gradually become harder, less elastic, almost rigid. And when that happens, they can no longer absorb the pressure wave from your heartbeat. The full force of every pulse travels directly forward, straight up into the smallest, most delicate blood vessels in your body. And where are some of the most delicate, smallest blood vessels in your entire body? In your brain. When arterial stiffness drives your pulse pressure higher, those tiny vessels inside your brain are exposed to a relentless hammering with every single heartbeat. Over months and years, that pressure causes what researchers call microvascular damage. These injuries are silent. You will not feel them happening, but the damage accumulates. Think about Dorothy again for a moment. Reading things twice before they sink in. Forgetting where she put her keys. These are not random occurrences. A landmark long-term study published in the journal Hypertension followed over 11,000 adults across a period of more than 10 years. Individuals with elevated pulse pressure, particularly those whose pulse pressure exceeded 60 millimeters of mercury, consistently showed significantly faster rates of cognitive decline beginning 8 to 10 years before any formal clinical diagnosis of dementia. Another major study from Johns Hopkins followed participants for nearly 2 decades and found that midlife pulse pressure elevation was one of the strongest independent predictors of brain white matter lesions. The brain and the cardiovascular system are in constant two-way communication. Damage to one drives dysfunction in the other. A man named Robert, 72 years old, retired engineer from Florida. His readings typically run around 125/75. His pulse pressure, 50, healthy range. His neighbor, Bill, also 72, whose readings typically run around 155/75. Bill's pulse pressure, 80. Without intervention, Bill's brain is aging significantly faster than Robert's, even if neither of them can feel the difference yet. If pulse pressure is so important, why isn't every doctor routinely discussing it with senior patients? Pulse pressure is a more nuanced measurement. It requires doctors to look at the relationship between two numbers rather than either one in isolation. You can calculate your own pulse pressure in about 5 seconds. You can track it over time. And the lifestyle and medical interventions that lower pulse pressure are real, documented, and available to you right now. Insight 1. A wide pulse pressure is almost always a sign of arterial stiffness, not simply high blood pressure. Insight 2. The brain's hippocampus, the region most closely associated with memory formation, is disproportionately vulnerable to microvascular pressure damage. Insight 3. One of the earliest cognitive symptoms is not memory loss, it is processing speed. Insight 4. Sleep matters to your pulse pressure more than most people realize. The nocturnal dip is essential for cardiovascular and brain recovery. Insight 5. Inflammation is the hidden driver. Chronic low-grade inflammation directly stiffens arterial walls and accelerates the accumulation of amyloid plaques in the brain. Insight 6. Dehydration raises pulse pressure, and most seniors are chronically mildly dehydrated without knowing it. Insight 7. Certain medications commonly prescribed to seniors can inadvertently affect pulse pressure. Some diuretics can cause diastolic pressure to drop disproportionately, widening the gap. The first and most important step is simply knowing your number. Night, take a reading. Subtract the bottom number from the top number. If it is consistently above 60, you should specifically raise the topic of pulse pressure and arterial stiffness with your physician. Write the words pulse pressure on a piece of paper and bring it to your next appointment. Aerobic exercise is the single most evidence-backed intervention for reducing arterial stiffness. 30 minutes of brisk walking, 5 days a week. Regular rhythmic movement causes the arterial walls to repeatedly stretch and relax, gradually restoring some of their lost elasticity. Think of it as physical therapy for your arteries. The DASH diet has been studied extensively in seniors. It emphasizes high intake of potassium, magnesium, and calcium through leafy greens, berries, nuts, and low-fat dairy, combined with dramatically reduced sodium intake. Sodium directly promotes arterial stiffness. Many processed foods, restaurant meals, and even canned soups contain far more sodium than most people realize. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, have demonstrated consistent anti-inflammatory effects on arterial walls. Chronic psychological stress directly elevates cortisol, which in turn promotes arterial inflammation and stiffness over time. Seniors who practice even simple stress reduction techniques, slow diaphragmatic breathing, gentle yoga, meditation, show measurably different autonomic nervous system responses. Consider requesting an ambulatory blood pressure monitoring test, a 24-hour monitor you wear at home, and during sleep, that captures how your blood pressure behaves throughout the full day and night cycle. Some research suggests that taking certain blood pressure medications at bedtime, rather than in the morning, may better protect the nocturnal dip and reduce brain-related risk. Your brain is not a passive bystander in your health story. It is deeply and continuously connected to the health of your heart and your blood vessels. Every one of them affects the flexibility of your arteries, and the flexibility of your arteries affects what is happening inside the smallest blood vessels feeding your most precious organ. Pulse pressure is not a death sentence. It is information. And information, in the right hands, your hands, is power. Dorothy, if she learns today that her pulse pressure of 56 is worth monitoring, if she starts walking in the mornings, reduces her sodium, talks to her doctor about her arterial stiffness specifically, she has done something powerful. Before you close this video, I want to ask you to do one thing. Take your most recent blood pressure reading and calculate your pulse pressure right now. If this video helped you understand something that you didn't fully understand before, please share it with someone you care about. An older parent, a spouse, a friend. Take care of your heart. Take care of your arteries, and take care of your brain, because they are all ultimately one system, and that system is still working for you. Let's keep it that way.